We begin tonight, actually, with news that is both good news and unsettling news from Wall Street. The Dow overall lost about 186 points today. Now, that is not catastrophic or anything, but it's one of those days where the market closing gets described as sharply lower on all of the business pages. Now, despite the market being down, the unsettling good news from Wall Street today comes from the New York Times Market Spotlight on today's most actively traded stocks. 4 of the 8 most traded stocks in America today were giants in the health business: Pfizer, Wyeth, Aetna, United Health, and all 4 had great days today, even as the rest of the market slumped. Why was today such a good day to be a stockholder in, say, United Health? Well, here's a hint.
And I think what's important is choice and competition, and I'm convinced at the end of the day the plan will have both of those, but that is not the essential element.
The bottom line for this, for the president, is what we have to have is choice and competition in the insurance market.
The public option, whether we have it or we don't have it, is not the entirety of health care reform. This is just one sliver of it, one aspect of it.
The fact of the matter is there are not the votes in the United States Senate for the public option. There never have been.
You know, when you have a weekend like that, it's no real surprise when Monday turns out to be a great day for health insurance stock prices. How did we get here? How did we get to the foretold death of the public option and United Health's awesome Monday on Wall Street? Well, we got here through a collapse of political ambition and the resultant downgrading of expectations for this once-in-a-lifetime, stars-aligned political shot at fixing the system that accounts for 1/6 of our economy, a system that is so broken that a majority of personal bankruptcies in this country are caused by medical costs, and a majority of those people who are going bankrupt because of their medical costs actually have health insurance. Trying to meet the healthcare needs of our nation of 300 million people by just hoping the private sector will provide has been a disaster. Check that, actually. It's been a disaster for the American people and the American economy. It's been great for the insurance companies and for the other big health corporations who've made healthcare for profit a better modern corporate racket than anything other than being a defense contractor in the Rumsfeld era. However we got to the system we have now, it doesn't have to stay this way. This isn't the way that other countries do it. And there are even long-standing pilot projects that have worked out pretty well, thank you, in this country for basing a healthcare system on the needs of patients rather than on corporations' need for a fat bottom line. The Veterans Administration, for example, offers one big, long-standing American pilot project for how to change healthcare. The Veterans Administration is a nationalized healthcare system. It's a totally public system. The government runs the hospitals. The healthcare professionals who work in the system work for the government. It's the same kind of system that the general public uses in England. Well, here in the U.S., a right-wing group opposed to health care reform called Conservatives for Patients' Rights has tried to convince Americans that British people hate their health care system. They've produced ads like this one, purporting to show real British people warning Americans about how bad their British NHS is. Well, the actual British people who ended up in those ads now say they were duped. They say they actually support the NHS, and they're horrified to learn that they are being used to discredit it. Another big, long-standing American pilot project for how to change healthcare is Medicare. Medicare is single-payer healthcare. In Medicare, the doctors and nurses don't work for the government. The hospitals can still be private, even for-profit, but the government provides the health insurance. They're the single payer. You essentially take the huge bulk of administrative costs for all the private insurance companies out of the system, and you end up with Medicare. You end up with a system that Americans have a much higher degree of satisfaction with than they do for private insurance. Most industrialized countries have single-payer or national health care, and they spend less, and they have better health outcomes than we do with our big experiment in hoping the private sector will provide. Presidents from Truman in 1948 through Kennedy and Carter and Clinton have all tried to reshape, to reform the American healthcare system, all to no avail. And by the closing years of the George W. Bush administration, the number of uninsured Americans was approaching 50 million, and the CEOs of the 10 largest health insurance companies were taking home an average compensation of $11.9 million each every year. In 2008, all change. Not only did the Democrats take the White House, but they did so with a candidate who explicitly campaigned on a health care reform promise. They won a more than 70-seat majority in the House. They won a filibuster-proof 60-seat majority in the Senate. If health care reform is ever going to be possible, it's never going to be more possible than it is this year. But from the very, very beginning, single-payer health care and national health care were completely off the table. As Matt Taibbi writes in his new gut-wrenching article on healthcare for Rolling Stone, when key Democratic Senator Max Baucus convened the first roundtable discussions on healthcare reform last May, Senator Baucus invited 41 witnesses to Capitol Hill to share their perspective on what ought to happen with healthcare reform. 41 witnesses over 3 days. Not a single witness was scheduled to speak in favor of single payer. Because single payer was inexplicably totally beyond the realm of consideration, Democrats ended up instead proposing something called a public option, a Medicare-like plan that at least some Americans could choose to buy into instead of buying private insurance. Now, apparently, even that is off the table, too. We know that the president, both when he was a candidate and well into the current debate as president, said that a public option was a must.
That's why any plan I sign must include an insurance exchange, including a public option to increase competition and keep insurance companies honest, and choose what's best for your family.
Must, he said. Must. He has changed his mind on that now, apparently. Even Max Baucus, the won't even consider single-payer conservative senator from Montana who leads the committee that is now dropping the public option, even Max Baucus was in favor of the public option as recently as last November when he published his big 100-page healthcare proposal that called for, quote, a new public option, a new public plan option similar to Medicare. So if Max Baucus was in favor of a public option, and President Obama was in favor of a public option, and a public option survived through 3 House committees and 1 Senate committee that passed bills on health care reform so far, why is the public option dying now? It's dying because of a collapse of political ambition. The Democrats are too scared of their own shadow to use the majority the American people elected them to in November to actually pass something they said they favored. Senator Baucus has decided to take decision-making about health care reform out of the full committee on which Democrats have a huge majority, and instead he wants it to be decided by a mini-committee that he made up. That's 3 senators from each party, as if the American people elected a half-and-half Republican and Democratic Senate this year, which we did not. We elected a big Democratic majority, but then Democrats decided to wield that majority by giving the Republicans control over what kind of health care reform we get. So we get no public option. We get no public option, no single payer, no national health plan. Maybe some insurance reform, maybe not. Depends on what else the Republicans want, probably.